Welcome back to Good Morning Kenya. My name is Jane Boy. Karibu tena sana. If you are joining us, this is Good Morning Kenya. Remember, our official hashtag ever remains Good Morning Kenya on Twitter. Our official station handle is at KBC Television. My handle is at Jane Boy. My colleagues, you can find them as Remanyara, Ash Ramaguko, and at Dorina Range. That is across all social media platforms, and of course our Facebook page, KBC Channel 1 TV, and our SMS number is 20154. So right now we are on to the second segment for the day, and today we just want to focus on matters health, as we always do every Tuesday. And today we are going to be talking about oral and dental health. Now, just looking at some global stats is that, there is at least half of the world's population has suffered tooth decay at one point or the other. At least half of the entire world's population. Another 3.9 billion people across the world suffer from one or the other form of dental disease that is left untreated, and there are over 291 oral and dental health diseases and conditions out there. But what are we doing to take care of our teeth? We take them for granted sometimes until you start having stinkerful breath, or you start having a toothache, or something starts to happen. That is when we start to take care of our teeth. But we want to have a discussion around that and see how we can best take care of our teeth. And to help us with this discussion, we have with us in studio this morning Dr. Paul Morumba Onyancha, who is a dental surgeon who runs a private practice that is Astra Dental Services Clinic, and also is part of Haven Dental Center in Karen. Karibu sana.
Thank you very much.
Glad you're with us this morning.
Thank you.
I'm sure you have your practice on social media.
Yes, we do.
Maybe you could give us those social handles so that our viewers can also know how to get in touch with you.
Facebook page, Astra Dental Services, Haven Dental Center.
Okay.
Yes.
All right. So if you have any questions, as I always say, that you feel you would like to be addressed on a more personal level, feel free to send them through via the social media handles that our guest has just given us. Now, let's just start with the basics.
Yes.
When we talk about oral and dental health, what exactly do we mean? Because we take it so casually, just think as long as you brushed your teeth, you're healthy, you're orally healthy, and your teeth are okay. But what does oral and dental health really mean?
Well, oral and dental health means the health issues that surround the mouth and the oral cavity. Now, the oral cavity is a very rich structure,
yes,
that contains blood vessels, tissues, salivary glands, and these tissues can be attacked by diseases and other external factors. Now, most of the patients who come to the clinic,
yes,
do not realize that they had these oral issues until they started
manifesting.
Exactly, started feeling pain,
yeah,
or they experienced bleeding gums, but they never really thought that they have
any issues.
Exactly. So these diseases, when they affect the teeth, the gums, your palate or your tongue, can really cause an array of symptoms and signs. Now, this may include cavities, which are holes on your teeth. You can also get bleeding gums when you're brushing your teeth, or when you come to the clinic and we use what we call a probe, and when we touch the gums, we realize that the gums are bleeding, and the pockets, which is basically the space between your gum and your teeth, is very deep. So there are other oral problems that may manifest much later,
yes,
such as what we call periodontitis.
We'll be getting to some of those conditions in a bit.
Yes.
But for most of us, we only wait until there is a problem,
yes,
until there's a loose tooth, or when you're having a toothache, to go see the dentist.
Yes.
Why is it important to just going for regular dental checkups, in as much as there might not be a problem, but just the necessity and the importance that comes with these visits?
Yes. Now, it's important to visit your dentist at least twice a year.
Twice a year.
For your oral check.
Okay.
Because there are some conditions that you may not, as a patient or a person, you cannot be able to diagnose yourself. This may include small cavities, which later may lead into bigger cavities. Now, when you have small cavities, we as dentists will do what we call fillings. So basically, a filling is just a material that is placed on a tooth which initially had a hole.
Okay.
So what we do is we remove the infected material on the tooth and then fill it up with
literally filling it.
Exactly.
Okay.
The other issues that may present to you as a patient that you may not see that is important for you to come to the dentist are things like ulcers. Exactly. And maybe early stages of cancers, oral cancers.
Okay.
So when you come to the clinic, we are able to pick these conditions. And there are so many tests that we do. First of all, when you come to the clinic, we ask you questions. We do what we call a history taking.
Yeah.
We ask you if you've ever visited a dentist before, how frequently you brush your teeth, if you have any pain, and the characteristics of this pain.
Okay.
So basically, after we've done that, we can take x-rays to see if you have any cavities on your teeth, or the extent of the cavities that you already have. So basically, it's important to visit your dentist because we can be able to pick these conditions much earlier before they become large.
Yeah.
And of course, having your routine cleaning is very important to prevent destruction of tooth structure and escalation of gum disease by doing what we call scaling and polishing. Okay. So we encourage patients to come to our clinic, parents to bring their children, so that they can start having a good health-seeking habit from a young age.
From the onset.
Yes.
The last time I was at a dentist, I think was when we were having our teeth removed. Back then, it's been so long, I can openly say that. And at least when we were younger, what we were taught, when you used to have, cavity, we just smash like a Panadol and then put it there and wait for it to chill. And it used to work, but those are just some of those home remedies that are not long-term, that we tend to make for ourselves, but at the end of the day, you just keep on delaying the problem and it becomes worse.
Exactly.
Now, maybe you could tell us some of the most common dental issues and oral issues that are there, as so that, because we take some of these things for granted. I think that is our biggest problem. We take these small things for granted so often, and yet they are just the surface of a deeper lying problem. Maybe you could tell us some of the most common oral issues that you have interacted with, and at least that affects the greater percentage of the population.
The most common issues that we see patients coming to the clinic are what we call dental caries. Dental caries is basically infection of the hard tissues of the teeth. Now, if you look at the tooth structure, the anatomy of the tooth structure, we have on the outer layer, you have what we call enamel. The enamel on the outer layer doesn't have nerves. So when you have a hole on your tooth, on your enamel, you may not feel pain. You may not
feel anything, yeah.
Now the second layer is called dentin. So when the infection now goes to your dentin, you start getting sensitivity because there are nerves there. Now, at the deeper side of the tooth is what we call the pulp. The pulp has nerves, blood vessels, lymphatic tissues. And now when the infection goes to the pulp, you have excruciating pain. So when a patient comes to the clinic and they have a feeling, just like I've alluded to earlier, they have a cavity, we do a filling. Okay. When the cavity is large and has gone to the pulp, we do what we call a root canal treatment. So cavities, dental caries are one of the common issues that we see. The other is what we call gingivitis. Gingivitis is basically infection of the gum. The gum, the technical term for the gum is gingiva. So just like
to gum.
like when you have your
tonsillitis,
pancreatitis.
Tonsils, okay.
Exactly.
Okay.
So gingivitis is basically infection of the gum. Now this infection, when left untreated, can spread to the support structure of the teeth, the periodontium and the bone.
That is why people lose teeth sometimes.
Exactly. Then you get what we call periodontitis.
Wow.
Exactly. So this gingivitis should be prevented before it reaches, it
That
spreads
point.
to, exactly. Because in
Okay.
your mouth you have
Bacteria.
bacteria. It will act on the sugars that you take, and it will form a slimy layer, matrix called plaque. So this plaque gradually accumulates bacteria, and then it develops into what you call a tartar. Tartar is much stronger to remove. That's why when you're brushing your teeth and you have tartar, you may not be able to remove it. So when you come
Tartar
to your
is
clinic,
this material that may seem whitish at the bottom of your teeth, in between the space between your teeth and the gum.
exactly, it's much stronger, it's darker,
Yeah.
and it cannot be removed by your
Ordinary
toothbrush.
toothbrush.
So you have to come to the clinic for professional cleaning, what you
Okay.
call scaling and polishing.
Okay.
So our machines can be able to remove this tartar from your mouth, so that you have good breath and healthy gums.
All right.
Yeah.
Now let's talk a bit about some of those symptoms that present themselves, but we
Yes.
still take them for granted.
Yes.
And let's just start with the plaque that you have just mentioned.
Yes.
Over how long does it take for this plaque to actually form as a result of gum disease?
Well, it depends. It depends on number one, the frequency of your brushing.
Okay.
There are some patients who develop plaque much faster. So, I mean, it really depends. It can be anything
For every
between,
patient, it varies.
It varies.
Okay.
So, basically, when you're brushing your teeth, when you're using your toothpaste and your mouthwash, you're basically trying to remove the plaque that can cause gum disease. So when it is left untreated, now it develops into tartar. Exactly.
Now, plaque in itself, is it meant to be there naturally, or is also as a result of one of the first symptoms?
Well, we say as dentists that every person we meet has a mild form of gum disease. So tartar, plaque, basically is just an accumulation of bacteria and the food that you. So there varies amount of plaque that in patient's mouth. Some may not really cause a lot of issues.
Okay.
Yeah, but when it's too much, you get things like bad breath and bleeding gums.
Okay.
So it really varies.
All right.
Exactly.
Again, every patient is different.
Exactly.
Now let's go to bad breath, aka halitosis.
Yes.
So many just say niju nimenyamaza sana, sijaongea sana, but tell us a bit about halitosis, or rather bad breath.
Yes.
What causes it even in the first place?
Bad breath, what we call halitosis, is basically as a result of gum disease. Now, just like a wound, when somebody has a wound, the tissue start rotting, and of course you start getting, the smell coming from.
Pungent smell starts coming.
Exactly. Yeah. So in your mouth, the bacteria that has acted upon the sugar that you take and the food that you take accumulates between your gum and your teeth.
Between the gum and the teeth.
Exactly.
Okay.
And of course, since your gum is a living tissue, it can be infected. You can even have pus. So this now manifests as bad breath. Now, there are some patients who get bad breath because of chronic bad breath because of really poor oral hygiene. Exactly. So when they have things like teeth which are not properly aligned or badly done, fillings, this can cause accumulation of bacteria in your mouth, and then cause that pungent smell.
Yes.
So when you come to the clinic, we do your scaling and polishing, and eventually the bad breath goes away. Now, the home remedies that someone needs to use to prevent bad breath is basically your normal toothbrushing. You need to floss your teeth, basically use a string to remove the food particles between your teeth.
Yes.
And then use a mouthwash. Now, a mouthwash, is antibacterial. It can reduce the chances of you getting bad breath.
All right.
Yes.
So, bad breath
Yes.
is as a result of just poor oral hygiene. It
Poor
doesn't
oral
just come
hygiene.
from anywhere. si ati juu umenyamaza sana.
No.
It's just a manifestation of what you didn't do right.
Yes.
Okay.
Yes.
Now let's talk a bit about sores that actually tend to appear on the gums, on the roof of the mouth. Maybe tell us a bit about that. What brings those about?
Now, sores can be brought about by so many factors. You can have what you call immunocompromised situations.
Oh, yes.
Exactly. Yeah, patients with HIV/AIDS, they can have sores in the mouth. Now, sores can also come about because of trauma. Trauma, that means your oral tissues have been punctured by whatever
Injury
reason.
to the tissues, yeah.
Yeah, it could be, chemicals, strong chemicals. It can be a sharp object.
So there could be other reasons beyond just the oral bit of it.
Exactly, that causes
Okay.
exactly. Yeah.
All right.
So they can be very painful, and when they manifest, the patient is very, a patient is not able to eat properly. They can't be able to speak. So when they come to the clinic, we do examination and we
try to determine the source.
Exactly, yeah.
Okay.
And there are remedies to prevent the sores, mouthwashes and gels
All right.
that prevent acceleration of the sores into something that is
could be worse.
Exactly, could be
All right.
worse. Yes.
Now, tooth sensitivity, and this
Yes.
especially in regards to temperature.
Yes.
Let's start with the cause of this.
Yes.
Because sometimes it just starts all of a sudden. Sometimes you don't have any issues whatsoever,
Yes.
but you find you just take a sip of cold water, your tooth hurts,
Yes.
or hot water, and it's your teeth are in pain. Tell us a bit about what brings about these issues. What predisposes you to tooth sensitivity?
Now, tooth sensitivity is usually as a result of the external factors that irritates the nerves, around your tooth. Now, and it's usually one of the signs of gum disease.
Because it's exposing the inner part of the teeth.
Exactly. So when you
Okay.
have what you call gum recession, gum recession is basically your gum going down. Remember, the gum covers a portion of the root.
Yeah.
So when there's a gum recession, that means
receding gums.
you're exposing your tooth to hot and cold drinks and
Okay.
foods, and you can get sensitivity. Now, sensitivity can also be as a result of your cavities, which have become large. Exactly. So when a patient has sensitivity and they come to the clinic, we check and see that they have cavities. When we feel them, the sensitivity goes down.
So
now, there are other
yes.
remedies. Sorry, you
No,
were
keep
saying.
going, keep
Yeah.
going.
So, so as we do the scaling and polishing, we're basically trying to restore the health of the gum. So with time, as you come to the dentist for your regular cleaning, and then you brush your teeth meticulously at home, and you use a mouthwash, the gum goes back.
Okay.
It grows back, and then the sensitivity now goes down. Now, we can also recommend what we call fluoride therapy. Yeah, in the clinic, we can do fluoride therapy to prevent the sensitivity. And then, of course, at home, when you use a toothpaste that prevents the sensitivity, you should be fine.
All right.
Yes.
So sensitivity is brought about by another problem. It doesn't just happen by itself. There's always another problem that has exposed the teeth or the nerves.
Exactly.
To this.
Yeah. Remember, I said the outer surface of the tooth
is dead, basically. Enamel
doesn't have
any nerves.
Exactly. So it's very hard for you to get sensitivity if you don't have exposure of the inner surface of the tooth.
Okay.
Yes.
So nasemanga nakwanga tu hivyo, nilizaliwa hivyo, meno zangu zinakwanga sensitive.
Yes.
No. There is a problem and you need to get it checked. Wacha kusema tu nakuanga tu hivyo. Utakuanga tu hivyo, anze kupoteza meno hapa.
Yes.
And then you will start crying for later. Now, there's this term you keep mentioning, scaling and something.
Scaling and polishing.
Scaling and polishing. What does that mean? Because maybe, okay, I want to know what that means. Scaling and polishing.
Well, scaling and polishing is basically a procedure that is done to remove the tartar and the plaque from your tooth.
scaling the teeth and polishing.
Exactly.
Okay.
In the clinic, we use what we call an ultrasonic scaler, which is a machine that vibrates. So as it vibrates, it removes the tartar between your teeth and your gum.
All right.
Exactly. Now, after we've done the scaling, we do what we call polishing.
Scaling, like removing scales from a fish, literally. Okay.
Exactly.
That makes sense.
Exactly, yeah.
All right. Then you now go to the polishing bit.
Exactly. We do the polishing, which is basically, you know, a brush that rotates at a high speed, just like your normal toothbrushing, but now we're using a machine. So that removes the plaque, it removes the stains. There are patients who also have, you know, stains because of, you know, coffee intake, tea intake. So those stains, you know, can be removed.
Okay.
Yes.
And
but the deeper ones can be very difficult to remove, you know, with the scaling and polishing. So we recommend other treatment modalities.
All right.
Yes, such as, I mean, so if a patient has fluorosis, now we start thinking about things like masking, crowns, and things like that.
All right.
Yes.
Now, on to the final symptom that you've actually just mentioned, you know, is the stains.
Yes.
And, you know, some could be as a result of chemicals in the water, coffee, as you have mentioned, tea.
Yes.
Tell us a bit about that and, you know, some basic or home remedies that we can go about to just help the staining or just prevent it as a whole.
Yes. Now, stains on the teeth can be classified into two parts. You have what you call extrinsic stains, which is basically staining on the outer surface of the tooth, which hasn't gone into the substance of the tooth.
Okay.
This can be caused by things like coffee, intake of coffee, tea.
Excessive intake of coffee?
Exactly, that can cause staining of the teeth.
Okay.
Now there's the other staining of the teeth that is caused by factors that, you know, causes chemicals to go into your tooth. Now, this is where you have things like dental fluorosis, which is basically intrinsic staining of the tooth as a result of high fluoride content into the water that you take or the food that you take that causes the brownish.
Oh, the browning of the teeth,
exactly,
the darkening.
Yeah, and this is seen, we see a lot of these cases in patients who come from
some specific areas,
of
geographical
this
locations.
Country, this country.
Yeah.
Now you also have stains on the teeth as a result of deposition of antibiotic usage during childhood. So this can be very difficult to remove by scaling and polishing.
Okay.
So we do other procedures to mask the stains.
All right.
Yes, but of course, as you were asking, at home when you're brushing your teeth, you basically are removing the stains that are on.
That is the first step.
Exactly, and then of course reduce your intake of coffee, tea. Yes, that can cause stains.
That can help, you know, bring down the staining.
Yeah, the staining. Yeah.
Okay. Now, one more thing is in regards to traditional medicine. We always see some, and I know at one point you have seen someone. There's some people who put some stuff here in their teeth, and it also ends up staining and bringing other issues to do with their oral health care. Maybe you could tell us a bit about, you know, some of these traditional remedies that are there that are harmful to our oral and our dental health.
Well,
I know you have interacted with some.
Well, I'll keep, you know, I'll keep the discussion to what we do in the clinic because that is what is permitted.
Yes.
You know, by our profession. I know there are people who do, you know, so many other, you know, procedures on their teeth to, you know, prevent dental pain, or you know, children when they're having, you know, pain and they're crying. So
traditional ways.
So we don't really focus on that. We say if you're having, you know, a child who has we suspect has dental issues, bring them to the clinic. We can be able to make a thorough diagnosis on the, you know, wide variety of issues that will affect the child, affecting the child, and then we'll be able to treat accordingly. Because you'll be surprised, you know, we have pediatric dentists. Yeah. You know, these are specialists who deal with children, you know, right from birth to you know, to about 7 years, 10 years. Yeah.
All right.
Yes.
So let us stop resorting to traditional options.
Yes,
That you know
exactly.
sometimes traditions could take you down a road that you might not be able to recover from.
Exactly.
Now let's talk a bit about brushing our teeth.
Yes.
We just brush our teeth, chap chap, mepitisha mbele, side, your tongue out. But what is the proper technique of brushing our teeth?
Now, the proper technique of brushing your teeth is always remember to brush all the surfaces of your teeth.
Okay.
That's number one. Then number two is use a soft bristled brush. Don't use a hard brush because your teeth, your gum is sensitive. So if you use a hard brush, you're most likely going to cause gum recession.
To hurt the gums.
Exactly. So basically, you brush all the surface of your teeth in a circular motion. Avoid. Yes, avoid vertical motions because you can actually injure the gum. And cause gum recession.
All right.
So all the surface of the teeth, and your teeth has what you call the inner surface, the outer surface, the surface that you use to chew in. Exactly. Yeah.
So you have to make sure your toothbrush, your soft brittle toothbrush, because I know people who actually prefer hard toothbrush.
It's a misconception.
Yeah.
And then take your time. Don't be in a rush. Don't be in a rush. There are people who brush their teeth 3 seconds and then they just rinse out.
Yeah.
So it's important to take your 3 to 5 minutes should be enough. And then at least brush your teeth at least twice a day. And especially before you sleep. The reason why, for that is when you're going to sleep, your mouth is closed and there's less saliva flow. So bacteria will act more at night. That's why patients, when they go to sleep and then wake up in the morning, they feel that they have bad breath. Because your mouth is literally, it's closed and you cannot be able to have constant salivary flow. During the day when you're talking, there's constant salivary flow, so it washes away the bad bacteria, the food that is in your mouth, and that can also go a long way to preventing gum disease.
All right.
Yeah.
Now, what about when it comes to changing our toothbrushes? Tunafaa kungoja mpaka ikae hivi, or how often are you supposed to do that?
We recommend that you change your toothbrushes at least after 3 months.
Every 3 months?
Every 3 months, it's important. Yes.
What about after you've had a cold or a flu or a lip sore for that matter? Is it also advisable to change your toothbrush? If it's still looking good, you can keep going with it.
Yes, if you've had problems with your teeth, your gums, infections, it's important to change so that you don't reinfect your oral cavities.
Okay.
Yes.
So regardless of whether it's worn out or not,
exactly.
after a cold, it's always advisable because the bacteria could still live through the brush,
Exactly.
All right. Now, when it comes to our children, I know for a fact that I did not brush my daughter's mouth until I saw teeth, and start giving them a kind of soft toothbrush to start using. For children, how do we also take care of their oral health? Especially infants and let's just talk of the category under 2 years.
Now, children after they're born, they start suckling, and you can find accumulation of the breast milk
on their tongue, a white layer
on their tongue. Yeah. Exactly. Yeah. So it's important to remember that this can cause infections. That buildup can cause infection. So it's important to, take a small, soft cloth to just clean, but don't use a lot of force because that can cause, injury.
Yeah.
Exactly. Yeah. But when it builds up so much, you can bring them to the clinic, to the dentist, and we recommend certain medication that will prevent proliferation of the bacteria and exactly in the mouth. Yeah.
All right.
Now, when their teeth start coming out, it's important to also, use the soft cloth to just remove plaque, which can cause gingivitis. Remember, gingivitis can affect children as much as it affects adults.
Okay.
And so when you start, when you do that, you're inculcating that good brushing habit right from the, and then let them also see you do it.
When do you introduce the toothbrush? When is it recommended to introduce the toothbrush to the young ones?
Well, it depends. There are some cases where the toothbrush can be produced much, much earlier when the central incisors, the lower central incisors are out. But the key thing is to basically remove the plaque, whichever way.
Okay.
Exactly, because sometimes the bristles can be, you know, a little...
Not too gentle.
Yeah, exactly. Yeah. But if you can be able to remove the plaque and then reduce the high sugar, you know, foods from
Their diet.
exactly from their diet, then that goes a long way to preventing dental caries, because we see a lot of children coming to the clinic with, you know, really cavities on their milk teeth.
I know.
And we tell them, we tell the parents or guardians that this child, because he or she has this cavities on the milk teeth, there's a high chance that they'll have cavities on their permanent teeth once the milk teeth are out.
But we take that for granted. We just think, you know, the milk teeth zitangoka ni sawa.
Exactly. And the reason why it's important to even address the oral health in children is because, you know, it has an impact on their general health. When they have dental cavities, dental caries, they get pain, they can miss school. And then, of course, it can be a bit difficult to treat children in the clinic. Yeah?
Yeah.
So it's so paramount to reduce, you know, high sugar, you know, your chocolate, your candies on the children's diet, so that they don't develop this dental caries. Parents and, you know, guardians will tell you when they come to the clinic, it can be very difficult to, you know, try to convince a child to open their mouth and have their, you know, fillings done or cleaning done.
Put in their mouth. It's even traumatizing for some children.
Yeah. So sometimes we end up doing what you call full mouth restoration under, you know, general anesthesia. So a patient is basically taken to theater and had all the procedures done under anesthesia if they cannot be able to cooperate.
Okay.
But surprisingly, some, you know, children are very cooperative, and this is also an indicator of how they, you know,
they have been cultured towards
exactly the experience, their first experience, you know, in a dental setup. So basically, it's important to just make sure that your children do not get these cavities at a young age because of the reasons that I've stipulated, and of course the cost that comes with it.
It is not cheap. These guys make a lot of money from our teeth. But then again, still on the children, you find some children, you know, 3, 4 years, they are missing this 4 teeth in between the incisors, both on the lower and on the upper gum. What causes that for some children? Well,
there's so many factors. It could be the teeth were removed prematurely. Yeah, I've seen a lot of cases where children are missing, you know, they're missing teeth, milk teeth, because probably the children are taken to a dentist. They had the teeth removed before their, you know, time had come.
Are there any genetic issues that could be related as well?
Exactly, there are genetic issues where you just have missing teeth, and this can be diagnosed. You know, a patient comes to the clinic, we do X-rays. There's an X-ray called orthopantomogram. It's an X-ray that shows all the teeth of the child, both the permanent and the milk teeth at different developmental stages.
Okay.
So we can be able to see this teeth and then advise.
Okay.
So of course, when they're missing teeth, we can advise, you know, on what is supposed to be done. And then when they reach the ages of 12, when the canines have already come out, if the teeth are not properly aligned, we can do orthodontic treatment, which is basically doing braces and straightening of teeth. So there are wide varieties of
reasons that could have caused that.
Exactly. Yeah.
All right. Now let's talk a bit about, you know, when it comes to toothpaste. Are all toothpaste good that are in the market, at least the ones that you have interacted with?
Now we recommend, first of all, toothpaste that is that contains fluoride, because fluoride is protective. Fluoride in toothpaste causes what you call remineralization and mineralization. So it basically protects the teeth against attack. So any toothpaste that has fluoride, and of course
Is safe to use?
Is safe to use, and then it has to be regulated by the various regulatory bodies. There are other toothpastes which are not very good, so we stick to the ones that are in the market and they're regulated by the bodies.
Okay.
Yeah.
What about for the population who are not able to have or rather get access to toothpaste? Alternatives that are still recommended that will still serve the same purpose as toothpaste.
Well, interesting question.
Toothpaste ikiisha tunafanya nini? In other words.
Well, if you have your brush and you're able to remove the plaque, then your chances of getting gum disease are much lower, and your chances of getting dental caries are much lower. But we encourage as much as possible to have a toothpaste during toothbrushing.
Okay.
Yeah, because of the twin reasons as that comes with toothbrushing.
Okay.
That is prevention of gum disease and dental caries.
All right.
Now, if you're in a place where you cannot be able to get your toothpaste,
toothpaste ikiisha.
of course, reduce your sugary
intake.
Yeah, have high fiber containing foods, and then take a lot of fruits. Exactly. So and then prevent have low sugar in your diet so that you don't get dental caries.
All right.
Yes.
You haven't mentioned salt, which is something that everybody, I believe, out there has tried at some point or the other. When you run out of toothpaste, we're always told, even at school, we're taught to use salt as an alternative. Is that safe in the first place? Well,
it's not dangerous.
Yeah.
But it may not really be as effective as your toothpaste.
Okay.
Yeah, but you don't. I mean, it will not make any changes to your plaque. But as long as you have your toothpaste and toothbrush, you should be fine.
All right.
Yes.
So, if you don't have toothpaste, you can always just brush with your toothbrush. You don't have You don't have to improvise as much.
Exactly.
Just control your diet in that space.
There are people who use sticks. To brush. Yeah, we discourage, because that can cause injury to the gum.
Receding of the gums, because you're always up and down, up and down.
Exactly. Yeah.
So that
try
is
as much as possible to get a standard toothbrush.
All right.
Yes.
Now,
which is available to the general population.
Yes.
And, if you look at the prices, they're not that bad. Yes.
Now, as we draw the conversation to a close, maybe tell us a bit about mouthwashes and the purpose of mouthwashes in the first place, because you find some, after brushing your teeth, you still run a mouthwash, and some just because you think it's healthy. But what is the purpose of a mouthwash?
Now, a mouthwash basically reduces the bad bacteria in your mouth that can cause gum disease and dental caries. Now, sometimes patients may not be meticulous in their brushing.
The brushing, okay.
But when they combine toothbrushing and a mouthwash, the chances of you getting gum disease and dental caries become much lower.
Okay.
Now, there are other mouthwashes that are also used after we've done surgical procedures. So if, for example, a patient has come to the clinic, they've had disimpaction, which is surgical removal of third molars. So we prescribe certain mouthwashes, Betadine, which
the most commonly used one.
Exactly, but those ones we don't recommend usage for long term. Yeah, the chlorhexidine best can be used, long term alongside your toothbrushes at home, almost every day, to prevent gum diseases.
So the mouthwashes that we see in our supermarkets, those ones are safe to use.
Yeah, those are safe
combined
to use.
with brushing.
Yeah, exactly. Yeah.
Okay.
Yeah, but
so
the some
helps.
we have to prescribe. Then you get from the pharmacy.
Okay.
And then the mouthwashes now will also clean between your teeth where your toothbrush cannot reach. Yeah, and when it's also used alongside dental floss, it can become very effective.
Now let's talk a bit about flossing.
Yes.
Anybody can floss from wherever you are, as long as you have a piece of string. But flossing, sometimes it tends to hurt the gums. what is the right technique of, flossing your teeth? How are you supposed to get, I have really tightly packed teeth, and sometimes getting past this upper part is really hard. So you have to like floss it and then now be careful so that you don't hurt your gum. When it comes to flossing, the proper technique of flossing your teeth.
Basically, you tie the string
On your
fingers.
index fingers or your fingers that you prefer.
Exactly, yeah. And then you
Slide it.
you slide into your, between your teeth, and then you do a
Back and forth
back and
movement.
forth, exactly. Yeah.
Okay.
Yeah, and then avoid going too deep into the gum, because you can actually cause injury and bleeding.
Don't go to the base of the teeth.
Yeah, exactly. Yeah. And as much as possible, if you can be able, if you're flossing on this side, do not use the same floss to this side, because you can actually
transfer bacteria.
Exactly. Yeah.
I use the same one through and through.
Yeah, but it can be technique sensitive. So we encourage, if you cannot be able to floss properly, come to the dentist. We'll be able to show you, so that you don't also cause other problems to your teeth.
Okay.
Yes.
And for the benefit of our viewer, we've just mentioned flossing, but what does it even mean in the first place? Just in layman language, just help our viewer better understand what flossing is.
Yeah, flossing basically is usage of a special string to clean between your teeth, because when you're brushing your teeth, the bristles may not reach between your teeth.
Yes.
So basically what the floss does, it goes between the teeth and then it removes the bacteria and the food particle that has been packed there. If you have crowding of your teeth, can become very difficult to floss. So of course, when you come to the clinic, we'll be able to show you, be able to do it as part of your scaling and polishing.
Yes.
Yes, exactly.
Okay.
Yeah.
All right, so keep sending your feedback. I will be sampling some of them before we call this conversation a day. The SMS number is 20154. Our official hashtag on Twitter is Good Morning Kenya. As Facebook page, KBC Channel 1 TV. And the hashtag is Good Morning Kenya, and the official station handle is at KBC Television. Now, as we bring the conversation to a close, maybe some of those dental and oral habits that we must adopt to just help ourselves keep our teeth healthy for as long as possible. What would you recommend, the basic routine or habits that we need to adopt?
The basic routine that one needs to adopt is always remember to brush your teeth at least twice a day.
At least twice a day.
Especially before you sleep, for the reasons that when you're sleeping, your mouth is closed.
More bacterial activity could happen.
Activities, exactly.
Okay.
And then brush on all the surfaces of your teeth, the inner surface, the outer surface, the surface that you use to chew. And then take your time. Do not be in a rush. Use a dental floss to clean between your teeth. And then as much as possible, if you can afford, get a mouthwash. And then it's very, very important to visit your dentist at least twice a year for your scaling and polishing, and for diagnosis of any other problems that you may have in your mouth.
All right.
Avoid sugary foods. Have
hapo kuna mtu anasema ni tricky.
Exactly.
Yeah. But you have to just try, even if you are sweet, to just bring down the levels.
Exactly.
Yeah.
If you take anything sugary like soda, make sure you rinse your mouth. Don't leave the sugar to stay in your mouth for long, because it can
clean,
cause
plain water.
Exactly.
So my sweet tooth people, it's okay, but just remember to rinse your mouth, gargle some water, or brush your teeth for that matter, to help your teeth stay as healthy as they can be for as long as it can be.